Yeast infections have been affecting many productive women across the world. Dr. Awaja, a gynecologist at the Edward Francis Small Teaching Hospital, talks about the infection and how it's contracted.
Vaginal yeast infection, also known as vaginal candidiasis, is a fungal infection that affects the vagina normally, and it's caused by a fungal, that is the candida. The candida is a normal flora in the mouth, in the throat and the esophagus, and in 20% of some women in the vagina it's normal. So, but when alterations happen in the vaginal environment, this can lead to the fungus replicating, growing faster, and this could lead to the vaginal yeast infection.
So how does one contract this infection?
Yes, the vaginal yeast infection, the people that are predisposed to it, mostly pregnant women, because in pregnancy the immune system goes down, all the hormone production and everything, it can expose them to be at a higher risk. Diabetic patients are at higher risk of infections because of the sugar level and everything. Women that are using steroids, those that bleach. Some people take steroids for therapeutic reasons, meaning for treatment, and others just take it for weight gain and all those things. Those that can, because what steroid does is it depresses your immune system. So your body does not have soldiers to fight any form of infection. So any little trigger, the yeast will grow and then at their high risk. Other people that are at higher risk of the vaginal yeast infection are also women that do vaginal douching. Some women will use so many types of chemicals to clean the vagina inside out. All these feminine stuffs. Because what happens is the vagina has a normal flora and a protective, that is what we call the lactobacilli. So when you put all these chemicals, it kills this. Therefore, all the protection in the vagina is removed. So any little thing, the yeast will grow and then you have the infection. Other people that also are exposed to the vaginal yeast infection is those that use antibiotics. Gambia, that's a problem. People self-medicate. You go to the pharmacy and give me amoxicillin, give me flagyl, and these drugs are not prescribed for you. So when you take these drugs, they're antibacterial, so they kill all the lactobacilli. So you're exposed to the yeast infection. Those that wear, like swimmers, those that wear swimming costumes, because mostly when they swim, the costume is wet and it's moist, and the yeast grows in moist environment. Those people are also at risk.
I think everyone have this white thing that comes out from them. So is it that we all have yeast?
No. Every woman has normal vaginal discharge. That's normal. It lubricates the vagina, protection and everything. But that discharge mostly is clear or simple white. It's not offensive and there's no color change. So when you see that it's thick or it becomes greenish or becomes yellowish, then you know this is infected. So because based on the color, the odor, you might determine which type of infection, whether it's fungal, it's bacterial or viral.
So does it mean that yeast smells?
The yeast, no, actually it doesn't smell. It's just this coat white, thick. It's just like cheese. You see, when you grind cheese, the way it looks like, that's mostly how it looks.
So can it disappear by itself, or do you need to go to the hospital to get treatment?
Yeah, most research was so 3 out of every 5 women have this vaginal yeast infection at some point in their life. Some people, that's what we call asymptomatic. They don't even know. Unless they go to the hospital, they checked. That's when it is noticed. If not, some people don't know. But in severe forms or in others that have been there for long, people might sort some form of treatment for it to improve. Yeah, a man can have yeast infection. That's Candida balanitis, where they will have this patch, white, thick lesions on the penis with excoriations and everything. So they can have. If a wife has and it's not treated, it can be transmitted to the husband.
She further talks about ways and means to prevent contracting this disease.
Avoid using tight nylon pants. You can use cotton pants that's natural, linen or silk. Anytime it's moist, you change it. When you suspect you have an infection, you can wash the pants with hot water. Just hot water, nothing. Hot water. It can help kill the yeast or the bacteria that is in there.
Many young women continue to contract yeast, but the perception they have towards it deter many from seeing a gynecologist.
Vaginal yeast infection is not a sexually transmitted disease. That's one thing we need to understand. Even somebody that is not married can have vaginal yeast infection. If you see under the causes, I did not mention sex or anything. I did not mention those things. So even those that are not married can have it. So it doesn't mean that you're sexually active when you come. And this gives problems to young women. You see, parents will come and bring their child. I need you to check for the virginity because the child has discharge. No, maybe the child has just a fungal infection or normal vaginal discharge. To the parents, not every vaginal discharge is due to sexually transmitted infection. And not every vaginal discharge is also normal. So it's important when people have vaginal discharges, before they do anything else, people use so many things. People use so many things to put inside there. The use of taba, it's one issue that we're fighting. People put taba inside and they will telling you, I have seketo, the mom it. It's, you see, you don't even know what that taba is causing to you. So before we use all these remedies, we need to go to the hospital. At the hospital, based on what they find, based on the tests they can do, they will know exactly what type of infection you have and what appropriate treatment to give you. There are also some home remedies for vaginal yeast infection. Some people might use coconut oil, tea tree oil, some can even use plain yogurt. But I think the best thing is go to the hospital where a diagnosis will be made and then you might be. So people keep using taba, they use lemon, people use honey, people use what they call, I don't know, powder or something. People use so many things. And you can see right now we have so many, sometimes you see so many people that come with bad vaginal infections, vaginal ulcers. It's all these chemicals they use. So I think you have, like I want to say, you have another way of satisfying your husband sexually by not putting yourself at risk.
Vaginal yeast infection often leads to a whitish yellowish vaginal discharge. It can be watery or chunky, a bit like condensed milk or cottage cheese. Sex can be painful when you have a yeast infection. Peeing also hurts. Scientists also estimate that about 20% of women normally have yeast infection in the vagina without having any symptoms. It has been revealed that the fastest way to detect the infection is to see a gynecologist. Reporting for the Fatu Network News Review, Umisau.